Welcome to the Tailored Healthcare Staffing PBDS Study Guide, Routes to Results. Today we are going to cover everything from what, who, when, where, and how, making sure that you walk away with all of the tools to successfully complete the PBDS assessment and start your assignment. For starters, it is important to understand what the PBDS is, the Performance-Based Development System that assesses a nurse's critical thinking ability in response to various clinical situations. Implemented in 2010, the PBDS is a multi-step, web-based assessment used to assess critical thinking skills and interpersonal skills of a newly hired nurse. The assessment evaluates the nurse's ability to recognize a patient problem and its level of urgency, and then identify the action steps needed to manage the patient problem. Having nurses successfully complete the PBDS assessment creates a more efficient team and a safer work environment that can significantly reduce patient readmission rates. There are 3 areas of focus on the assessment: critical thinking, technical skills, and interpersonal communication. The critical thinking skills assesses clinical judgment based on problem recognition, risk management, and prioritization. Technical skills are assessed regarding safety, effectiveness, and efficiency. And finally, interpersonal communication skills include team building behavior, conflict resolution, and customer satisfaction, for example, bedside manner. So who uses the PBDS? More than 500 healthcare providers nationwide use the Performance-Based Development System of assessment. Any nursing specialty can require the PBDS assessment, but each specialty will be assessed under one of 4 categories: medical surgical, critical care, neonatal ICU, or OB. ER nurses would be assessed using the critical care set of questions. What is the timeline for the PBDS assessment? The standard assessment takes between 4 and 6 hours, but travel nurses are occasionally given an abbreviated version which takes between 2 and 4 hours. Once the assessment is completed, the results should be computed and received within 1 to 2 business days, but may take longer depending on the facility. If a hospital requires an assessment, nurses must complete the PBDS before the start of each new assignment. Some hospitals require nurses to be assessed every 6 months or occasionally when changing specialties. If, for some reason, you do not succeed on your first try, try again. The soonest a nurse can complete an additional assessment is 2 weeks after the original. However, the time limit depends on the hospital's regulations. The assessment will take place at the facility where the nurse will be working on assignment. You may be asking yourself, what exactly is the PBDS? How does it work? The assessment method is essay format. There will be no multiple choice. It is important for you to document all steps in treating the patient to the best of your knowledge. Remember to read and follow directions exactly and analyze the situation as you, a registered nurse, would normally do. In the first step of the assessment, the nurse is presented with several 1 to 2 minutes video scenarios. Handouts are given before the video, but make sure to read them after, so they do not distract you or cloud your judgment during the video. A handy tip while watching: pay attention to vital signs, clock hours, IV fluids, and other background information that could be important. Step 2 requires you to determine the main problem. In Step 3, you will rank your priorities and the urgency of each problem. Step 4 is the bulk of the assessment, where you will state your intervention and treatment priorities. You will be given 5 to 7 minutes to type your responses. Interventions fall under 4 categories: diagnostic, invasive, non-invasive, and cognitive. make sure you do not waste your time. Think about the importance of what you must do, what you should do, or what you could do. Include routine procedures as simple as walking into the room, putting on your gloves, or introducing yourself. Also, do not forget to include repetition of steps if necessary. For example, checking vitals every hour or changing a dressing. Step 5 is where you will support your interventions and treatment. Step 6 is the Interpersonal Communication Skills Assessment, which evaluates how nurses interact with their surroundings. Interpersonal communication skills include customer service skills, bedside manner with a patient or family members, interaction with coworkers, supervisors, and colleagues. The assessment is looking to identify calm and effective discussion of diagnoses and directions, as well as rational responses in a crisis. Part of this assessment involves an audio statement, usually of a startling or inflammatory nature. Respond appropriately and rationally, keeping patient care and safety as the main priority. Once you have completed the assessment, your results will be computed and recorded. Results are not quantitative, based on numbers, they are qualitative, based on the quality of your responses. Results fall within a range of either unacceptable or acceptable. Unacceptable means a nurse did not successfully complete the assessment. The evaluation under unacceptable includes does not meet, inconsistent, does not meet for problem management, or limited does not meet. Acceptable means a nurse successfully completed the assessment, and a facility can then choose, based on the range, whether the assessment is satisfactory. The range includes limited but acceptable, meets for stated experience, meets with exceptions, and exceeds. There is a reported 70% pass rate for those who prepare for the assignment ahead of time. Here are some tips and tricks Tailored Healthcare recommends when preparing for the assessment. First of all, remember that your THS staff, the recruiters and account managers, are on your team. We have complete confidence that you have the skills required to successfully complete the assessment and start your assignment. Most of the facilities we work with do not require a PBDS assessment. However, when accepting an assignment, always be sure to ask your recruiter if and when you need to complete a PBDS assessment and what you should bring to the assessment. Do not hesitate to call your recruiter if you have any questions. Before completing the assessment, there are a few things we would like you to remember. Firstly, don't panic. The PBDS is a skills assessment, not a memorization exam. If you think your skills in a certain area are a little rusty, do the necessary research ahead of time, and you will be fine. Refresh your memory. Refamiliarize yourself with diagnoses and actions related to common emergency situations in the cases of cardiovascular, circulatory, and respiratory issues. Do not take the skills you use every day for granted. Review them to make sure you can express them in writing. One of the most important things to remember is to use extreme caution when doing internet research. Stay away from websites that bash or complain about the PBDS. Getting angry or anxious about the assessment will not help you pass. Instead, use the internet as a tool to help you study certain skills and concepts you may need to review. Do not try to find specific information about questions on the assessment. Remember, just because it is on the internet does not make it accurate. Spend your time reviewing your own skills and experience, not someone else's. Here are some scenarios to consider as you review. What would you do if a family member cardiac arrests in a semi-private room? What if you are scheduled for an annual review today? If the doctor says you have to accompany your patient to a procedure that may last up to 90 minutes, how should you react? If there is a code at the beginning of your shift and there are still family members present in the room, what should be your course of action? If you have a nursing student working with you during your shift, how do you change your routine to include them? If there is a staff meeting in an hour, what changes do you make to your procedures? Below is a list of topics you may want to review before the assessment. Refresh your memory on the diagnoses and the treatments that each requires depending on the patient's other symptoms. Here are some important tips to keep in mind during the assessment. Watch the videos closely. You will not be able to repeat the videos, so be sure to watch carefully and not zone in to just one detail. Do not leave out the obvious items. Be sure to include even the smallest commonly known steps in your answers. Remember the basics like your ABCs. Be sure to assess any possible problem. There will not be a situation where the patient is just fine. Do not overthink a situation based on a completely different instance. Assess the information as it is presented. The correct response can be formulated from the information given. Congratulations! Now that you have completed the assessment, be sure to call your Tailored Healthcare recruiter in about 1 to 2 days to find out your results. Once you have completed an acceptable assessment, you will be ready to start your assignment. If you have any other questions about the PBDS assessment, your assignment, or travel nursing in general, feel free to give us a call at 866-871-0568. Our recruiters are available 24/7 to make sure that you are on the assignment that is perfect for you. You can also find us online at tailoredhealthcarestaffing.com or follow us on Facebook and Twitter.